This is the Spinal Homecare Workshop. If you don't know me already, I'm Dr. Jake Shupe, and I'm excited about going through this stuff with you guys. We're talking about spinal hygiene tonight. And I want to start off with a quote from Thomas Edison. And he said this in the early 1900s. He said, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." So what is the first part? He'll interest his patients in the care of the human frame. As chiropractors, that's what we do. And that's what we're talking about tonight is the care of the human frame, your structure, your skeletal system, including the spine. Really, the spine is the backbone to your structure, literally and figuratively. So your posture, your structure equates a lot to just not how you feel, but your longevity and your health. In biology, something that we're taught very early on is that structure equals function. So the structure of your spine equates to the overall function of not just how you move your muscles and your joints, but so much more. And I'll go into that in a second, because you hear a lot about personal hygiene. You're taught at a very young age that, staying clean and washing your hands and taking a shower and washing your hair. Personal hygiene is important, taught at a young age. Dental hygiene is taught at a very young age. You need to brush your teeth, you need to floss your teeth, go to the dentist and get a checkup every 6 months. We know that. That's culturally known and accepted. But how many people, if I went down the road and I pulled 50 people, how many people do you think would know the importance of spinal hygiene? Or would any of them really even know what that means or how to do that? If I had to guess, almost nobody. Very few people really know what that is. So why we have to talk about tonight, why do we need to take care of our spines in the first place? Why is this so important? And then we're going to talk about how you practically do it. And if you guys have questions tonight, you can just type it in the chat. I got Dr. Christie helping me out as my virtual assistant today. So if you got questions in there, we'll try to get some of those questions answered if they're pertinent at the time. But I'll hang afterwards tonight and answer some of those questions. Of course, if they don't get answered tonight, you can talk to myself or the team in the office, because these are really important, that you not only know what you're doing, but how to do it properly. So let's get into it. All right. I've got my home care kit right over here. So take a look here. I've got my chiropractic table with all my stuff on it. I encouraged you guys, if you can, it's certainly not necessary, but if you have some of this stuff with you tonight, it may be helpful. I'm going to go over all the pieces to the home care kit, how to use it. Before I do that, though, I want to talk about some key concepts. And first one is just going to be a disclaimer. Like, if you have your spinal home care sheet, only do the exercises that are been checked off and recommended by myself, or if you're from another office, from a corrective care chiropractor. Not everybody does the same exercises. Everybody's spines are different. There's some things tonight that you're not doing, but most of this is going to apply to you. And so I'm going to go over as much as I can. And I'm hoping that you guys can see and hear. I've not done a workshop online with actual equipment before, so we're going to see how this goes. But either way, you're going to learn some good stuff. And so only do the exercises that have been recommended to you on your home care sheet. Don't add anything, because you could actually do more harm to your spine. These are based off your specific x-rays. Also, the other big main concept that I want to talk about is this, and you might want to write this one down. It's called mix, fix, and set. And when it comes to spinal correction, this is one of the just kind of the approaches that we take to correct the spine. It's mix, number one, fix is number two, and set is number three. And that's the order that we want to correct the spine in. So mix, that's warming up the tissues. That's warming up the spine properly. And that's the first thing that you got to do. You got to get loosened up, get blood flow into the tissues. The warmer the tissues, the better they'll correct. So the two exercises that are in the mix category are the neck traction and the wobble exercises. That's why we always have you do those first. Those should always be the first two things that you do because they're warming up the tissues. The second component, fix, only I can do that for you, or only a chiropractor can do that for you. That's the actual chiropractic adjustment. We're physically moving the bones. We're physically mobilizing and realigning the bones. That's the fix portion. And then you've got the third component, which is set. And set is strengthening and stabilizing or molding the spine into the correct position. Excuse me. So set, that's strengthening and stabilization. And the first set, or the first part, mixing, and the second part, set, or the third, excuse me, numbers are way off. The first part and the last part, you guys are fully responsible for. I'm doing the adjustment, which is the fixing, but you're warming up the tissues and you're setting and strengthening. So it's the mix, fix, and set approach. And the reason I'm laying that out to you guys is because the order in which you do things does make a difference to your overall success. So I'm going to go through the 5 components of the home care kit, starting with the neck traction first. And I'm even going to tell you the order that I'm going to go in. First, I'm going to go over neck traction. Then I'm going to go over wobble cushion. Then the third thing is we're going to do weights and cerviguard. And then the fourth thing will be the wedges. And the fifth component will be the rolls or sleep aids. And I do it in this order because this is the order that I would do it in if I had to do everything, if my recommendations were to do all of it. So let's start with the neck traction first. This is by far the one that I get the most questions about. And it's not so much how to do it, but how to set it up properly. So I'm going to step back to my chiropractic table for a second. I'm going to grab my neck traction. And let's go over this. So before I go over how to do everything, I want to tell you the purpose of the neck traction. The neck traction warms up the muscles and the ligaments in your spine. It also pumps nutrients into the disc spaces between the bones. Many people don't know this, but after puberty, there's no blood supply to the discs. The discs are the cartilage, the cushions in the spine, and they protect the nerves and the bones. After puberty, no more blood supply. The only way to get nutrients to the discs after puberty is by motion. It's the only way. And so we have to properly pump the discs and get motion into the spine. So this warms up the muscles and ligaments, pumps nutrients into the discs, and it also, there we go. It also, thanks, Dr. Christie. It also, to some extent, helps the curvature in your neck. So that's going to be a big purpose. This helps not just with like neck pain, stiffness, tight muscles, headaches. It helps with that. It also can help with radiculopathy, which is like shooting pain down the arms and hands. can help with degenerative disc disease, which unfortunately many people have. Even stenosis, this exercise can help with. All right, so how do you do it? Well, it comes in two parts. It comes with this block. This is an older version. The logo is updated on your guys's. So there's a block and a rope with the neck traction. You're going to take the block, you put it over the door, and you close the door. And then this hangs down. You're going to tie the rope to the block. And then you're going to make sure, I pull on it a couple times to make sure it's tight and secure. And then basically this is going to go behind your neck. This goes under your chin. And you're going to take your underhand grip. Make sure it's an underhand grip. I see I have to correct a lot of times in the office, I'll see people doing it like this. That pushes the shoulders back. It's really hard to get a good pull like this. You need to be doing an underhand grip, just like you're doing an underhand pull-up, okay? And then it's under your chin, and you're gonna squat down and up, down and up, down and up. This is a cyclical traction. You know, many people have heard of neck traction, but the classic type of neck traction is going to be a sustained traction where like there's a harness just pulling and holding your head up like this. This is totally different. In fact, I believe that this is even more effective and better for a majority of people. So it's a pump, release, pump, release, pump, release. That pumping is warming up the tissues better. And it's also putting nutrients into the disc spaces to help degenerative disc disease. In fact, you can actually repair damaged discs. People will say all the time, oh, well, you can't heal a disc, right? Like once it's diminished, like it can't be regenerated. It can. Now, to what extent? You know, if it's super damaged, are you going to get the full thing back? Probably not, but there's a lot of times where I see 25, 35% increase in repair of regenerated discs just from doing corrective chiropractic, including these spinal exercises. Very powerful. This is the one of all these that you have to be very careful with. You've got to make sure that you're doing this safely. So I'm going to show you on the door here. Now behind me, you can see my door. It's kind of far away, but you can kind of see where it's at. There's a lot of people have doors that are not solid all the way through. Like this one here, it's hollow on the inside. These doors are not as stable. You can still do it on them, but you have to be more careful. And you cannot be hanging your whole body weight on this neck traction. In fact, even if you have a sturdy door, it's not recommended. You should only be putting about 30 to maximum 50% of your body weight on at the end of the pull. And again, you're not hanging down here like this. It's just pump, release, pump, release. Also, other mistakes people make is they lean backwards or they're leaning too far forwards. You want this rope to be hanging straight down, okay? If your rope is angled like this or angled like that, you're not in the right spot. Rope should be hanging straight down. You're directly underneath of it, down and up, underhand grip, never putting more than 30 to 50% of your body weight on it. Pumping cyclical motion, average recommendation is 60 repetitions. You do it like this, you're going to be safer and get better results if you do it. A solid wooden door or like a solid all the way through thick, heavier duty door, you're going to put it right in the middle. It's even a little bit safer, especially on these thinner doors, to move the neck traction, air it a little bit closer to the hinges. Let me show you. I'm going to step away for a second. So that is not in the middle of the door. I have it closer to the hinges, especially on those thinner doors. Then you can have it more stable because you don't want to rip your door off. You want to be able to get your nut tractions in, make sure that you're safe, and keep your house intact all at the same time. Personally, I don't do it on a door. I have a shelving unit, a very sturdy, heavy duty shelving unit in my garage where mine is just secured there permanently. If you want to, you can get like a mounting screw with a hook on it and put it into a stud in the ceiling in your garage or a place that you don't mind in your house. It goes into the ceiling, make sure it could get into a stud or hanging down. And then you can just put the neck traction on it and just have a permanent setup. That's what I do. But if you're going to be on a door, slightly closer to the hinges, and make sure that you hear that the door click, make sure it's latched, make sure you tug on it a few times before doing your neck traction. I believe that the safety of this exercise is the most important of all of them. So that's why I spent a little bit longer on this first one. I hope that answers a lot of questions. If you still have further questions on the neck traction, make sure that you ask. You can drop it in the chat and I'll answer it afterwards. Or if you're just having trouble setting it up, you can bring it into the office as well. So that's the first step of the mixing of the tissues. Warming up the tissues is the neck traction. The second step is the wobble cushion. So everybody knows about the wobble cushion. It's the easiest one to understand. It's the easiest one to perform. It's the safest one. It's one of the most talked about. It's the one of the most beloved is the wobble cushion. Also a mixing, also a warming up one. I'm going to demonstrate for you. I'm going to sit on my table and demonstrate. Okay. So you're on your wobble cushion. The purpose of this is to also warm up the muscles and the ligaments. It also pumps nutrients in and out of the disc spaces to help prevent and even reverse degenerative disc disease and help even prevent arthritis. So it's going to warm up the spine really well. There's 3 motions that you're going to do. The first one is going to be side to side like this. Okay. This is the correct way to wobble. Oh man, that feels so good. In the office, I see a lot of this. I'm moving my hips kinda, but I'm not going through my full range of motion, and I'm not seeing the head moving. You also, not only do you want to move your hips, you want to get your ear as close to your shoulder as possible at the same time. So it's all the way here, all the way here, back and forth. You do, most common recommendation is 20 repetitions of that movement. So back and forth, that's 1. So 1, 2, 3, 4, 5, and so on. The second exercise is going to be front to back. So you tuck your chin down, roll forward, and then look all the way up at the ceiling, arch your back, and looking all the way up. So all the way down, all the way up, down, up, going through your full range of motion. Sometimes when people will ask, well, what do I do with my hands? Like, should I have my hands down? It doesn't matter. You can have them down. I sometimes will sit them on my lap. You could have them out here if you want. Doesn't matter. You just got to get through your full range of motion. The third movement is going to be your twist. So I tell people to bring your arms up. I like to make a fist. I keep my fist about 4 or 5 inches away from each other. I found that this position provides me the best leverage for the twisting. So you twist all the way to one side, all the way to the other, going back and forth. This one is my favorite of the wobbles. A lot of times you'll feel like a pop or a release in your spine. Sometimes people ask if that's okay or if that's concerning. Nope, that's called a transient fixation. That's a good thing. Your spine's just loosening up and you might feel a pop or a release. That is good. Just like with the first exercise, you want to make sure that the head is following. So it's not just here. This is partially effective. If you want full effectiveness, the head will follow. So all the way this way, all the way this way, going back and forth. So 20 side to side, 20 up and down, and 20 twists for a total of 60. Sure. The front to back, or sometimes called up and down, is going to be all the way down and all the way up. Again, arching your back like this. This is your full extension here. And this is all the way down. So typically it's 20 of each for a total of 60. Those are your two. The neck traction and the wobble exercises are the two most universal mixing, warming up the tissues. You always want to start with those ones first. Next component of the Spinal Homecare Kit is going to be the weights. Now, everybody has a different weighting protocol. Neck traction and wobble, I would say 99% of people do both of those. The weighting protocols can be very different. So I'm going to go over all the different weights that are common, and I'm going to go over a couple of different protocols. And so look at your sheet and see what your protocol is, and then I'll give you some tips and tricks to this one as well. So you've got your 10-pound hip weight, and that is going to be going on like this. That's going to hang. Now, most people's will hang in the front. Some of you, though, you do a posterior hip weight where it will hang literally like on your butt, like on your tailbone. I'm going to do an all anterior setup because it's the most common, but only do what's on your sheet. I'm just going to give you some of the most common protocols. So this is a 10-pound hip weight. 95% of people do this in the front. And you see how there's an angle? The weight sits right in the small of the lower back. It should not be on your tailbone. If the belt is on the tailbone, is too low. It should be sitting about L3, L4 area, right in the small of the lower back, and it should have a slight angle to it. That helps pull a curvature into your lower back and strengthen that into that position. Some people will have it so tight that it's literally sitting straight. That's not the best angle. You want a little bit of angle. I mean, you don't want it hanging at your knees, like way down here, but there should be a little hang to it. That's your 10-pound hip weight in an anterior position. The second weight I want to talk about is the chest weight. There's a 5-pound and a 10-pound chest weight. This is a 10-pound, and this is always an anterior. It's going to be hanging in the front, just like this, in good posture. And then also the head weight. So the head weight, there's a 1-pound, a 2-pound, and a 3-pound. The 2-pound head weight is the most common. This is going to be sitting like this, okay? It's going to be, I'm going to try and step back a little bit so you guys can see a little better. It's going to be like this, okay? Should be sitting low on the brow, but high enough to where you can still see. Okay, I'm not going to actually put it on, but I'm just kind of holding where it would be. You strap it on, it's secured, and, well, let's put it on just for better showing, like this. Okay, see how it's sitting low on the brow? If you can see like an inch or two of your forehead, it's too high. It will not have even close to the same benefit if I can see your forehead like this. It should be sitting low on the eyebrows, okay? So right now, Let me get you admitted in here. There we go. So right now from the side, I have my 10-pound hip weight. I have my 10-pound chest weight and a 2-pound head weight. This is a common protocol right here. 10, 5, and 2. It's an all anterior setup. Now, here's what you got to know. Whatever your setup is, don't get lazy. You have to be focused. You have to be intentional. And you can't really be doing a lot of multitasking. I'm very serious about this. If you don't do these weights properly, you will harm your spine. And the subluxations that we're concerned about correcting, you can actually make worse. Let me show you. Here, I'm standing tall. I have my chest up, my chin up nice and level. I'm in good tall posture, right? I'm in good posture. But a lot of times I'll see this. Instead of this, I'll see kind of like this. Like people are just not holding the weights up all the way. They get a little bit sloppy. They get a little bit distracted. They get a little bit lazy, or they just have forgotten. So this is very bad. This is excellent. This is exactly what you want. That little bit from here to here, life-changing difference for your spine, for your re-x-rays, for your nervous system, for your posture, for your muscles, for your pain, for your health. This is how it should be, is upright all the time. You can't be like doing dishes. You can't be typing on your computer. You can't be doing a lot of multitasking. It's upright for 5 to 15 minutes. Well, what do I do for 15 minutes? Well, you can just stand. I like to march in place. I actually have a vibe plate in my garage. So that is an option if you want to invest another $1,000 to $2,000 in your spinal health. You can get your own really nice vibration platform. If you're considering that, which you certainly do not have to do by any means, but if you're considering it, talk to me first. Don't go buy a crappy one. If you're going to get one at all, get a nice one, or just don't worry about it. So, standing nice and tall for 5 to 15 minutes. This is one protocol. Another protocol that's very common is just without the chest weight. It's just a hip weight and a head weight. Again, same thing, chest up, chin up nice and level, nice and tall. You can walk around. Like I'll walk it up and down my driveway. As long as you're upright, you can walk. Then you can get some extra steps in. At the old office I used to work on, the patients used to walk around the building with the weights on. Sure, people think you're weird, but it's probably think you're weird anyways. So, but it's for your health and it's good exercise. So you can walk around, you just have to stay upright. I think I've driven that point in, okay? Now, another protocol, and this is the last one that I'll go over with the weights before we move on, is going to be the hip weight with the CerviGuard brace. This came out a few years ago, and this is probably one of the greatest spinal corrective tools that I've ever seen. Now, especially if you've been newer in the last year or two in the office, many patients utilize this. This has kind of almost taken first place over the head weight. For years, the head weight was the #1 tool, and there's still many patients that need and use the head weight. But for people that have had ligament damage or their spine buckles with the head weight, the CerviGuard is a fantastic tool. So the purpose of the CerviGuard is to correct your forward head posture and help a curvature in your neck at the same time. It's like doing two things at once, which the head weight can do as well for some people. I would say 90% of people that the CerviGuard helps both of those things, even people with severe ligament damage. So this is a great option. So you pop this off, I like to always keep one side on, and I just pop one side off, goes over your shoulders. Once you get good at this, you can do this really quick without a mirror. You just put that on, you start clicking it back. These cheek pads are going to be right on your cheek. They're going to push your head backwards. So you just start twisting these back, and then you're going to count the notches that you're recommended. So mine is usually at 2 notches. So from the back, I just take my finger and I count 1 notch, 2 notches. Perfect. It's right up against that. That's 2. Let's see this one here. 1, 2, 3, 4. I need to crank that back 2 more notches. Boom. Now it's nice and tight. And I'm still chest up, head up like this for 5 to 15 minutes, helping the curvature in my neck, helping the curvature in my lower back, pushing my forward head posture back. Amazing tools to strengthen and stabilize my alignment and my posture. And even more effective that I did my mixing first. I did my neck traction and my wobble first to warm up the tissues. Now I'm setting it and strengthening it into a best position. Of course, if you are in the office that day, you're getting an adjustment in between. If you're at home, you're just mixing and setting, mixing and setting. In the office, it's mix, fix, and set. At home, mix and set. So much more effective when I'm doing this. So you do it 5 to 15 minutes. When you're just getting started with it, you might do it only 5. Once you're more used to it, your round is going somewhere between 10 to 15 minutes with weights on. So those 3 exercises, the neck traction, the wobble, and the weights.
Yeah, I'm not in the office either.
Those 3 in a row.
You want to try it, then I can try to throw the name that you caught. Reach out to them, but you want to try back, I won't answer the phone.
I'm gonna try to mute here.
Okay.
So if you're unmuted, please mute. I thought I had everybody muted. There we go. Okay, so those are the 3. We've got 2 more components to the home care kit. Dr. Christie, any other pertinent questions at the time that I should answer or wait till the end? Perfect. Awesome. So now we're going to talk about the wedges. Before I go over that though, if you're in corrective care, you're doing these exercises twice a day, once in the morning, once in the evening. If you're in maintenance care or wellness care, you should be doing these just once a day. Of course, you can do more if you're trying to get more correction, but maintenance care really once a day. I will be totally transparent. I've been getting adjusted regularly, weekly for like 13 years. Every single week. I haven't missed a week of adjustments in 13 years. 20 years of total chiropractic care pretty consistently, but 13 years without missing. I've re-x-rayed my spine every year for the last 13 years. I know what it takes to keep my spine in a healthy place. Thankfully, I have in comparison, I have a really healthy spine. It's not perfect, but it's in a very good spot. So I know what it takes. I'll just tell you that I've done home care for over a decade. Do I do it every single day? No, but probably 4 or 5 days a week, I regularly do my home care. And after re-x-raying my spine for years and years and years, I know that it's enough to keep it in a good place and to keep my body healthy and feeling good. So for most people though, I mean, it's got to be at least once a day. I mean, this is just like brushing your teeth, just like eating healthy, just like exercising. These are part of your regular routine that you're doing your home exercises every single day. And the worse your health, the worse your arthritis, the worse your symptoms are and your pain, and then you would be erring more on the twice a day, especially if you're in the intensive and corrective phase, then you're absolutely doing them twice a day as far as your recommendations go. And hopefully tonight, understanding why and how to do them better will help you guys a lot. 2 more sections to go through. We're going to talk about the wedges. Let's show you these. Okay. So the neck traction is the one that probably gets the most questions because people don't know how to set it up properly. The wedges are the ones that get almost this equal amount of questions, but the biggest mistakes get made with these. The misplacement of the wedges are the number one thing that I have to fix. And at best, misplacing these just makes them ineffective or less effective. At worst, you're messing yourself up and your spine up more. So what are these wedges for? The most common thing that they're for is helping pelvic rotation. So what does that mean? If you're looking at me here, if my hips are rotated, they're like twisted like this, okay? So my right hip is going forward, my left hip is going back, there's twisting. A lot of people have pelvic rotation. So by placing these wedges, one high and one low, that's helping unrotate your hips, okay? So I'll show you from the side. One high, one low. And typically, now this is kind of hard to do all this on the computer here, but so the high wedge should be touching the bony part of the back of your hip, okay? The bony part of the back of your hip on the high side, right here. On the low side, the low wedge should be touching the bottom third of your glute. So bottom third of your glute, about right there, okay? Left high, right low, that would be one protocol. Some people, your sheet might say the opposite. Your sheet might not have the wedges on it at all. Again, these are specific to your spine. But if you're doing pelvic rotation wedges, one is high and one is low. Let me show you some of the mistakes that I see here, okay? I'll see, instead of the wedges being like this, one high and one low, I'll see people place them like this. Do not place your wedges like this. There is not any protocol for your spine that shows this being beneficial. This is actually quite painful. And it's one reason why you'll want to stop doing them immediately, or it feels weird. So you want the wedges to be like this. The fat part goes to the outside of your body. The thin part goes to the inside. Now, I will say that over the years, Freedom Family Chiropractic, me and my team are a little bit to blame here because we have to draw a picture of these and we're not like the best artists in the world. And sometimes these pictures in the past, especially they'd be more angled like this. They can be, these days I just tell them just straight, one high and one low. It's the easiest way to explain it. Our teacher, Dr. Tony Nalda, told us that the ideal way is a slight tilt, but when you draw them with a slight tilt, some people think that they're like this. This is not the case. This is very bad. This is the easiest way to do it, and this is how I actually still do it myself for my own wedges. So one high, one low, right on the bony part of the hip, on the bottom third of the glute. The low one is just touching the bottom part of your butt cheek, your gluteus maximus. So this is helping with the pelvic rotation. You know you're doing it right when you feel one hip is about a half an inch higher than the other hip. I'm going to lay down on my chiropractic table and I'm going to show you how I do this, okay? Another thing, when you're on your wedges, kill two birds with one stone and lay on your neck roll. Now, we haven't got to the rolls yet. That's the last one, but I'm just giving you a heads up. We'll talk about this next. You can lay on your neck roll while you're on your wedges. The wedges can be done on your bed or on the floor. The floor is going to be firmer. If your bed sinks in too much or it's way too soft, try doing it on the floor. But if you have a firmer mattress, it is okay to do your wedges on the bed. I'm going to show you on my chiropractic table here, okay? Give me that white pillow, please. So I'm gonna lay down and I'm gonna show you another tip. So first I'm gonna place them. So mine's a right high, left low, because my pelvis is somewhat rotated posterior on the right. So I'm gonna put a right high, a left low to untwist them this way. So I lay down, I lift myself up, one here, one here. The one's right here, one's right here. And when I lay down, I've got my neck roll, help my cervical spine. And I can feel my right hip is about a half an inch higher. It's unrotating the pelvis. Now, what you don't want to do, you don't want to bring your knees up. What I'll see people do is when their legs hang straight down like that, they'll say that it's uncomfortable or that it's too painful that way. So they'll bring their knees up like this. Do not do that. It completely negates the whole setup. It takes all the pressure off. So what I do is I get a pillow and I put a pillow under my knees, which creates a slight bend in my knees. It just supports my knees a little bit. I got my right high wedge, my left low wedge, and then I can stay here the whole time. But you don't want to pull your knees all the way up. So Dr. Jake's tip is to try to have a pillow under the knees so that the legs don't lock out. If you're fine with the legs being completely straight, you don't have to, but I think it's more comfortable and I think you can lay there longer on them. But do not pull the knees all the way up. You're 10 to 20 minutes on the wedges. Those wedges are really firm, okay? First couple times, first week you're doing these, do not be surprised if you get sore or that it's uncomfortable. If you're concerned at all, talk to me, let me know. But majority of the time, it's just normal. We'll make sure that you're placing them correctly. That's first and foremost, the most important. But even when you're doing it right, I mean, we're trying to correct the spine. Don't be alarmed if there is some soreness. Just let us know and we can make sure you're doing it right and get the results that you need. There's one other presentation with the wedges that is not for pelvic rotation. It's for spondylolisthesis. What is that? If you don't know what that means, that is a slipped vertebrae. So let's say this is the bottom vertebrae in your lower back, L5. L4 is supposed to be lined up with that. But a lot of times people will have a slipped vertebrae, meaning L4 will slide forward. It's the most common. L4 and L5 is the most common slipped vertebrae. So how do we fix that? If you can't just adjust that forward because it'll make it worse. You can adjust underneath of it, but spinal exercise wise, what you do is you'll do a wedge. It's called an increased sacral base wedge. And maybe 10% of you on here are doing this exercise and you only use one of the wedges for it. I'm going to demonstrate it really quickly. So I still have my pillow to help keep a slight bend with my knees. In fact, for the increased sacral base wedge, which I just sometimes call butt lift wedge, because that's literally what it's doing, is lifting your butt up. The pillow is even more important for that one, to keep a slight bend in the knees. You only use one wedge, and it's going to be down. So the tapered part will go up and the fat part will go down towards your feet. So just remember, fat to the feet, fat part to the feet. So that goes down, tapered part up. And what you're doing is you put it under your butt, right on the tailbone, right in the center, and still use your neck roll for neck support. You're straight down like this. It's literally tilting my butt up. It's lifting my butt up. And when it lifts it up, gravity is pushing that L4 vertebrae down to help that slipped vertebrae. I've got the pillow under my knees. This is the one I've seen people do this. This ruins it. Don't bring your knees up on either of the wedges. You do that, you're going to get even better results. Okay. So that is the wedges to help with either pelvic rotation or slipped vertebrae called spondylolisthesis. It also can help with sacral extension as well. We'll sometimes recommend it for that. Some of you do it for that as well. Same presentation though. Last little comment on the wedges. Start with 10 minutes, work your way up to 20 minutes, maybe 10 minutes, then to 15, then to 20. This will also be working better after exercise. So that's why you'll always still want to do your neck traction and your wobble first, because you warm up the tissues. And then when the spine cools down in that molded position, it will stabilize better. So that's pretty much most of what I wanted to recommend for the wedges. The last part is going to be the rolls. So there's my neck roll right there. They're in your kit. There's 2 sets of rolls. Let me show you. You've got a blue set, and some of mine are super old because I've been in Max Living for a long time, but they're different colors. But you have a blue set and you have a gray set. There might be a couple of you that have a red set and a gray set. Same thing. The colored set, the blue or the red ones, they're medium firmness. That means they're a little bit squishier. They're a little softer. We typically recommend starting with the medium firmness one at the beginning, just to get used to them. And then later on, or if you've been under care for a while, graduate to the gray set. The big one is a 3-inch roll. The little one is a 2.5-inch roll. This one gets mixed up quite a bit as well. But the big one is for your neck. A lot of people think that since your back is bigger, that the big one would be for your back. That's not true. The big one goes in your neck, behind your neck, right in the middle of the neck. The little one goes in your lower back. And you lay flat on your back. You should not be using a pillow. If you use a pillow with your neck roll, it will still help with the curvature, but it's going to create forward head posture. You need to be laying flat on your back with the rolls. Again, you can put a pillow under the knees to keep a slight bend in the knees and be more comfortable and sleep longer. I understand that not everybody can sleep on their backs. You don't have to, but the ideal goal would be to try to sleep on these as long as possible. Start with at least 30 minutes a night, and you incrementally go longer and longer. It could take 6 months to a year to learn how to train yourself to sleep on these all night. But if you're a back sleeper or a side sleeper, or if you're a stomach sleeper or a side sleeper, and you just simply cannot sleep on your back, then you just got to lay on them as long as you can. Something is going to be better than nothing. Again, these work better, just like the wedges, they work better after exercise. So that could mean your spinal exercises, or if you've just worked out and your body's still really warm and you want to go home and you want to take a little break after your workout. This is something that Dr. Christie has utilized a lot. I've done it a couple times over the years. Dr. Christie has done more often, or she'll do it after like a sauna session. But if your body is really warmed up and you want to take a rest and you cool down on the rolls and you cool down and mold your spine into an ideal position, it's even better, works even better. So this helps. And when you're sleeping, that is when your nervous system and your immune system ramp up. When you're sleeping is when your body should be repairing and healing the most. So the best possible spinal alignment that you can be in will help your nervous system function and heal your body the best. In fact, if your spine is in an ideal position, you may be finding over time that instead of like 8 or 9 hours of sleep, you might need less sleep, because if your body is in an ideal position to heal faster, you might not actually need as many hours as you did in an unideal position, which is pretty cool. So do your best, but if you're not a back sleeper, try to lay on them as long as you can for the best results. So we went over everything. We went over the mix, which is the neck traction and the wobble. We went over the set, which is the weights, ServiGuard, wedges, and rolls. We went over the common mistakes that people made, went over some of the main tips to make sure that you're doing them correctly. If you have further questions, please ask me. Ask the team up front. Talk to me in your progress evaluations. It's pertinent that not only that you know why that you need to do them, but how to do them, and making sure they're specific to you in your individual home care sheet. So make sure that you ask. And if you're not currently under care, or you don't currently have a home care kit, message me, direct message me online, text me if you have my number, or you can comment on this video as well, and we'll reach out to you about how you can get evaluated to get proper recommendations for your home care kit. So any questions on there, Dr. Christie? So my amazing virtual assistant, Dr. Christie, has been answering a lot of questions along the way. So thank you for that. Here's a question from Ashton. ServiGuard, is it okay with the TV? Also, it's a great question. I'm actually really happy to answer this one, because people want to like, hey, if I'm gonna wear my stuff, can I watch TV at night? It depends. If you're with the weights on, if you have a hip weight or a chest weight or a head weight, those have to be done standing. Okay, have to be done standing. It's inappropriate to try to do those in a seated position. ServiGuard alone, ServiGuard by itself, which most people don't have that recommendation to do by itself, but let's say you did your hip weights and already, ServiGuard by itself can be done seated, okay? But in a good, tall, seated posture, yes, ServiGuard can be done seated. I don't recommend it though, because most of you need to be doing your hip weights anyways. So you would put your hip weight on, slap your ServiGuard on. You have to be standing for those. So if you're watching TV, you have to make sure that your TV is out in front of you this way or looking up. If your TV is at all down like this, even with the CervaGuard on, do not do it. You can't be on your phone. You can't be looking down. Oh, even in the rehab room, you know, I have the, when you guys are in the office, and I have the rehab TV, you guys are slightly elevated on the vibration plates, but the TV is just a little bit lower. If you want to look at the TV, you have to look on the bottom of your eyes like this, because you have to keep your head up. You can listen to the TV, but don't do anything that's going to drop the chin down at all. So I don't care what you do, but do not bring your chin down or your chest down at all. So technically, yes, you can if your TV is high, or as long as you're standing. That's a great question. I do get that one quite a bit. Hopefully that makes sense. How do you know with the wedges? Here's another question from Gina. How do you know if the wedges, how do you know which one is high and which one is low? That will be on your home care sheet. It'll say a right high, left low, or it'll be the opposite, left high, right low. That is something that myself or one of our other trained team members will look at your x-ray and see the rotation, and they'll put together the correct configuration. So that will be on the home care sheet. Great question. Speaking of the wedges, there was one last thing that I wanted to say. For the rotational wedges, there's a high one and a low one. And I've had people say this a few times before. They're like, oh, the high one, that pushes my hip up. But that low one, it doesn't seem to do anything. So I just only use one. And they're only using the high wedge on the one side. Don't do that. The low one is doing something, okay? It's not the main lifter. It's a supporter. The high wedge lifts the hip up. The low wedge blocks the femur. It keeps the femur from rotating outwards. Otherwise, your hips would just do this completely. This one pushes the hip. This one blocks the leg, which is the femur bone. Make sure for the rotational wedges, you are using both. I know that wasn't the main question, but did just need to say that because I've had some people try to change that up. Got a comment on here that says this helps a lot. Neck rolls are awesome in the car. Excellent. I'm so glad that you mentioned that, Ashton. Absolutely. I keep because most people have 2 sets. Or if you don't have 2 sets because you're sharing one with a spouse or a family member and you want an extra set, probably the best extra $35 that you can spend. I keep an extra set in my car and I use it as a lumbar support in my car. It's way better than the cars, even in luxury vehicles when they have the lumbar support. It's, in my opinion, still not that great. It's better than nothing, but it will not be the same benefit as a progressive foam roll. So in the car, I keep my extra set and I use my roll while I'm driving, because some of the biggest complaints that I hear people make are sitting and driving too long. I only commute 37 minutes to the office and I keep it in my car all the time. So that's a great recommendation there. Ashton, do you use both rolls when you're on your back? Question from Jennifer. This is another great question. Only if recommended. Most people are recommended to do the neck roll and the back roll, but some people that already have too much curvature in the lower back, they don't use a back roll. They'll only use a neck roll, and that will be recommended on your home care sheet. We've already known that information for you. So if you do not have a back roll on your recommendation, don't use it. Very helpful. That's all the questions that I have. I did pretty good on time tonight. That was pretty much like almost like an hour spot on. So hopefully this helped. We will record this. Oh, we got a last second question. Here we got one. Let's take a look here. What about in ergonomically poor chairs? Back support for that. What do you do? Basically, a cost-effective ergonomic support for poor chairs or work from home folks. Another great question. Yes, you can use the rolls in even a office chair or even any chair that has a back. Some chairs like have like a high back and there's like a cutout at the bottom. See how this chair, like it has something all the way up and down. Anything that has support from the bottom all the way to the top, you can stick a roll in that like this. And you can lean back up against it like so. And you can put your lower back roll in there. Or if you want a little bit more of a roll, sometimes I'll even stick the bigger one in there while I'm in a seated position. But if it has a solid backing, yes, then you can use your lumbar rolls in that as well. Give it a try. If you have questions about your chair, it might be a little weird or bad, take a picture of it, show me in the office, and I'll be more than happy to guide you in the right direction. All right, so it looks like Dr. Christie said some people even use their wobble cushion on their chair at home while working. Another great recommendation. I wouldn't recommend doing that all day, but you can certainly create a dynamic work environment by taking it on and off for periods of time. Maybe you sit for an hour or 90 minutes and you wobble for it, and then you sit on it and wobble back and forth for a while, and then you take it back off. There is no single position that a human being should stay in all day long. There's no perfect chair. There's good chairs. There's no perfect chair. You should not be sitting all day, even in a perfect ergonomic position. It's not good to sit. You shouldn't be sitting all day. You shouldn't be standing all day. The human body, even in ergonomic positions, is made to be dynamic, meaning fluctuating from one position to the other, never staying in one spot for too many hours at a time. So if you can keep that in mind, you will certainly do better. All right, last question, I believe, on here. All right, two more here. Can we do the wobble on the floor? No. I was asked this question the other day. I've thought about this, and unless you were the height of a toddler, which would be approximately 3 foot tall, there would almost be no great way to wobble on the floor. It's just not a good position. It would put too much, your legs would be pushed up too high, and your legs need to be down some. So you do need to be on a chair. In the office, I will wobble on the kids' chairs, which is about as low as you can go. So, the kids' chair is probably about this high, and then the wobble cushion is another this high. So that's about this high off the ground. But no, I would not use the wobble cushion on the floor. There does need to be at least a small chair. Good question. What is the vibration plate recommendation? May have to save for a better one. That is a little bit longer of an answer. Let me just say this. You can go out and buy one for maybe a couple $100, 100, 200, 300 bucks. I certainly would not buy one in that range because those ones are usually an adjustable frequency. You want one that's a set frequency. And I have it written down. All the ones in our office are a set frequency of vibration that has the research backed, showing the benefit. The ones that have the variable frequency are not only not as effective, but can actually do, I don't know how harmful they are, but they can cause some harm to the body. So you want to set frequency one. Either you just don't worry about it and just use your home care kit as is, which is probably a recommendation for most people. If you are really interested and you want one, there's a couple of brands that I recommend, and the Max Living brand, Bulletproof brand, and Vibe for Health. And it's been a while since I've ordered one, but I would just say this: if you're interested, just come talk to me, because there are certain companies that you need a license to order them. There's some that you can go outside and do it yourself, but there's some that you need a license for. And if you talk to me, I'll guide you in the right direction for your price point, for the best one for your best price point, and I could maybe even get you a discount or a deal depending on where you order from. So if you're interested in that, talk to me in the office or comment on the video when I post this video.